Thank you everyone for joining us for another learning lunch hosted by formatapproved.com. My name is Brian Johnson. I'm the Senior Director of Online Education with Format Approved, and I'll be your moderator today. Today's learning lunch will cover patient engagement is an important focus of Meaningful Use Stage 2. We're joined today by Heather Montgomery of iMedical Consulting, a leading provider of medical training and support with a focus on meaningful use and helping practices navigate compliance and the transition underway through Obamacare. Heather has a wealth of experience in healthcare and health IT, as you can see on your screen, and we're pleased to share her expertise with you today. Some quick notes before we begin. Please note that you can ask questions of our presenter at any time during today's session by entering them into the chat area during the presentation. In the second half of our session, we will address as many questions as time allows. If we do run out of time, answers to all submitted questions will be posted to our website and sent via email link later in the week. Also, note that all registered attendees of today's session will receive an email with links to both the slides and the recorded version of the event. And as a special note, we may be joined today for part of our session by Dr. Popkin, who's also the president of iMedical Consulting. So I'll allow Heather to introduce him when the time is right. All right, Heather, first of all, thank you for joining us. It's a real pleasure to have you here.
Thank you, Brian. It's a pleasure to be here.
All right, well, let's get down to it then. First of all, why is patient engagement such an important part of Stage 2 of Meaningful Use?
Well, obviously, with all the changes coming down with Obamacare and Health Information Acts, the government is very focused on reducing the health care costs and burden of this country. And they're looking at patient engagement as, or they're calling it rather, the blockbuster drug of the century. We're looking at really improving the outcomes of patients with age-related diseases and managing multiple age-related diseases and polypharmacy and effects on the hospitalization rates and all of the costs that everyone knows are burdening our country and causing what they're calling the fiscal cliff, if you will, of health care. And so one true secret to health reform is really getting patients engaged in their health and their families and their caretakers engaged in their health to better understand how to manage these diseases and prevent secondary occurrences or even initial occurrences and live a better life and quality of life without having to deal with the personal and financial burdens of being sick in this country. And really, health transformation can't happen until the facilities and doctors get their patients more involved in their own health care and engage their families in the patient's prominent goal and communicating that information across providers.
All right, well, that makes sense. So what is the government, and in particular CMS, doing to meet this patient engagement goal? And maybe just tell us a little bit about the program.
Sure. You know, stage one of the Meaningful Use Initiative obviously was to get the doctor's offices accustomed to utilizing an electronic format and to reformat the flow of their office. And that was a big change for physicians. And of course, just getting all the records in a digital form and getting all of the staff knowing how to utilize it, how the doctor can utilize it without it slowing down their encounter. And so, of course, they rolled it out in phases, and stage two really focusing on, now that you've got this technology, how can we use it to better educate and engage the patient and share this information across providers? So what they did is they put in, of course, several providers or benchmarks to mark patient engagement and to track it through, of course, their EHR systems and of course, report that back to CMS so that doctors can participate in the reimbursement that the government was offering for them going over to this electronic health record in the first place. And the benchmarks are required to exact a positive impact on the quality of health care that the public receives. And so what they did is they looked at, number one, how is data accessed, and that's number 7 of the meaningful use. And they want doctors to really provide their patients with the ability to view online and download and transmit their health information within 4 business days of being available to the eligible provider. And they are going to be measuring whether doctors are actually doing this, and they want 50% of all their unique patients seen by the provider during the reporting year to be given that timely access. And then furthermore, they want those patients actually logging in, 5% of them, during the reporting year to either download or transmit that information to the third party that's managing their health. So they really are requiring the proof that doctors are actually providing patients with that access and that patients are accessing it and utilizing it to manage their health care. The second one is secured messaging, and that's using electronic messaging to communicate with the patients on their relevant health information. And that's going to be measured by the EHR system tracking whether or not the doctor and their staff are utilizing the email services to notify patients of important health requirements, preventative screening measures, results of testing, and other reminders that would be important for their health. And the other things that have been updated as objectives is clinical summaries. The doctors are being requested to provide a clinical summary for each office visit within 1 business day to more than 50% of their office visits. So CMS really wants patients getting a summary so they really understood what happened at their doctor's office and what they should do to proceed forward to better health. And then number 13 is giving that patient specific educational resources that are identified by the EMR based on their health conditions to educate them how to better manage those disease states. And they are measuring that, wanting 10% of all unique patient office visits seen during the reporting year to have access to that patient-specific educational resource. And that's something that's unique because doctors have been disseminating educational information for years, but they want it to really be targeted to the patient's results and current medical condition. And the last one is reminders for preventative and follow-up care sent to the patient, not just via email, but per the patient's preference. It really is becoming a digital world, and patients are used to doing everything on their mobile devices and accessing information immediately, so they want the doctors to be cognizant that different patients have different methods of communication to really identify the right method for each patient.
So it sounds like it's really an effort to nudge providers into taking digital communication with patients seriously. These tools need to be in place so that patients can be aware of their own health information, also have, HIPAA compliant communication with their provider. So there's a lot of great initiatives in there.
That's right. And in order for them to take action, they need to understand what they need to do to act. And you go to your doctor's office and, they're going over your medications and your conditions and your next test, and a lot of patients leave out of there with maybe 30% comprehension of what just happened.
Sure.
And not for any fault of the physician, but just, the nature of the human being. So this electronic format will help to, increase compliance, patient satisfaction, and clinical outcomes is what their goal is.
So CMS has set these benchmarks, and you say here on the slide that the benchmarks are really, and this is in line with your comments, the whole purpose of it is to improve the quality of care.
Yeah, that's right. It all goes back to, you can follow the money. Of course, we all want to live a healthier life, but where it comes to CMS and the government who's having to foot the bill for the Medicare world and the cost of health care, they just realize that we've been treating sickness in a manner that doesn't reduce burden, and more of the baby boomers are entering into that age group, and quite frankly, the finances aren't there to continue to support what we've been doing from a health management perspective.
So we've talked a little bit about this, but what is the purpose of patient engagement? What are we really trying to accomplish here?
Well, I think the doctors would agree that are on the call that they've been telling their patients to live a healthier lifestyle for years. And, of course, patient compliance is a critical factor. And patients need to really understand, what's in it for them and have some education. Scare tactics, have been proven to not be as effective as actually educating a patient and following up with them so that they can take that proactive role in their health. And ultimately, regardless of all these incentives and measures and guidelines and changes in Obamacare, the patients really need to take accountability and act. And that's where the patient engagement is such a strong focus, because the government realizes that they can't get out of this tsunami alone. They need the help of the country to take it seriously and engage in their health, and as well as the families that are involved in supporting patients that are ill and taking care of them.
Now that's an interesting point. How do the families play into this then?
Well, in many cases, I mean, even if you look at particular disease states like MS or lupus or Alzheimer's or dementia, I mean, patients just aren't exactly capable of managing the complications of their bills and their doctor's instructions and getting their refills and making sure they're getting their physical therapy or their mental health therapy. So many times you'll see the children of parents or the parents of children managing the patient's health, and so they need to have access and education as well to understand how to best support that patient and create a positive or more positive patient outcome.
So this may, for doctors on the line, this may seem like an obvious question, but I think it's a fair one that we should address. Why is it important for physicians to engage patients in their health care?
Yeah, I mean, I'm sure that it's glaringly obvious for most physicians, and for years they've been wanting to do this, and we are going to address this in the next question. Managing a practice is difficult, and there's time restraints, and for the physician to take the time and educate their patient slows down the amount of patients that they can see a day and the ability for them to keep their doors open. So I like to say, number one, of course, from the purely altruistic standpoint, a sense of accomplishment, increased reputation in your field, higher referral rate, and the demand is high for doctors to provide a higher level of service and wellness and managing patients and keeping them from getting sick in the first place. So obviously, most importantly, it's vital to improving the patient's health and outcomes. And most doctors got into medicine, I hope, to help patients. So number one, of course, that's obvious. Number two, patients that are well informed have been shown to be higher compliers and to have better patient outcomes, and to improve their ability to communicate important information with their other healthcare providers. So the doctors need to now coordinate. Patients are complicated. Primary care physicians are dealing with 4 and 5 comorbid illnesses in some cases, and a couple of other specialists. So they really need to help that patient be able to travel from one specialist to another and relay that primary care information properly, hopefully digitally or in a printed version, so that each other care physician can properly manage that patient's special illness, if you will. But from a what's in it for me standpoint, doctors are going to be really struggling to comply and understand all the changes that are coming with Omnibus and with EHR and with Obamacare and ICD-10, and they have to find a way to adapt to the current healthcare environment and engage the patients, offer more services that are cash-based, that are wellness-oriented, that create revenue streams for their practice, and that improve referrals, because it's going to become too expensive to try to stay in business the way that they were used to staying in business, and too frustrating, quite frankly. So it's important for them from a business management perspective, as well as just
Well, Heather, I'm glad that you mentioned that, because, the healthcare aspect of it is important, but the business aspect of it is also something people really need to pay attention to these days.
Many employers are now going to part-time because premiums for all their full-time employees, and so the patients are going to be picking up the cost burden. And that's going to help because they're going to want to engage more in their health. And if the doctor's there to say, I'm ready if you're ready, I think they're going to see a higher engagement than they ever have in the past because of that. And patients are realizing, now I have to pay for my bad lifestyle choices and comorbid diseases much more than I ever did before. So I think it could improve a practice if it's handled right, and it obviously will improve outcomes. So it can be a win-win, but it's just a little bit difficult to change from one way of running an office to all these new incentives, requirements, compliance needs, and the needs of the patient. So we can help.
Well, and I know we're going to talk more about sort of coordination of care here in a little bit, so I'll save those questions for then. For now, how are these additional requirements affecting practice flow and resources inside a practice?
Well, this is just exactly what we're talking about. I mean, most doctors' staff are working at full capacity if they have a healthy and robust practice. So now you've got all these new requirements. You need to have a security officer trained and on-site managing your security. You need to have somebody that's an expert in your EHR, EMR. You need to have a billing expert, and then you have to have your care coordinator. So if they just add this as another requirement and don't add a dedicated staff member, what ends up happening, just like it did when they initially rolled out EHR, is it creates more patient questions. The time to educate them will slow down the practice flow and the encounter time with a physician, which tends to lead to decreased practice income. Whereas if you set the office up correctly, where there's a dedicated person in charge of that education and follow-up with the patient that's generating revenue streams and helping to manage some of the new changes in Medicare, the doctor can focus on what they want to focus on, which is patient health issues and preventing complications and further disease issues. So it can actually increase the doctor's productivity, but in many cases, if not addressed properly from the beginning, it will slow them down.
All right, so this is sort of parallel to the business issues we've been discussing, but how can improving patient outcomes through patient engagement affect the management and marketability of a practice? So let's talk about it from a business perspective.
Yeah, so the silver lining really is that, ultimately and ideally, this is the way that practices should be practicing medicine, and I think it's the way that doctors want to be practicing medicine, but due to the burdens of managing a practice, a lot of times there's just not enough time in the day. So if you set yourself up right to manage this properly, it will actually generate revenue, it will improve patient outcomes, it will increase referrals to the practice, it will enhance that marketability when it's time to retire or sell the practice, because of the fact that you're really meeting the needs of the patients, you're complying with the regulations and requirements that the government is pushing down the pike, and it will increase their reputation because their colleagues that are all struggling and trying to figure out are going to go, how are you doing it? What's going on with that, with your office, that you're able to just be sailing through this with no problems. The integration of a dedicated person providing health planning and health products and services to improve revenue really does have a huge impact on patient satisfaction and compliance. And I can't tell you how many offices were like, we just cannot believe how well our patients are receiving this, and they're thanking us on a daily basis for bringing these types of services and for getting those follow-up phone calls going, how are you feeling today? They're like, wow, my doctor's office is calling me. And they refer their friends and family because they want their loved ones to be cared for in that manner. So there can be a very positive outcome. Of course, the effect on healthcare and the way that doctors are also being reimbursed is changing. So there's shared savings from private insurers and Medicare, and I think we talk about that a little bit later, but it can improve billing in many ways, both through the billing of insurance and the cash revenue that's coming in and the increased patient base that can be a result of offering this type of patient engagement.
All right, so now we're getting into some of these changes that are coming to reimbursement, and some of that I know is through the Affordable Care Act. And tell us a little bit more about how coordinated care organizations benefit from patient engagement. Why are they related?
Well, ACOs was a push from the Obamacare changes, and they were wanting, obviously groups of doctors and hospitals to get together and reduce the costs that are affecting the hospitalization and the surgeries and, the prescription and the redundancy in testing. And so they really put together an aggressive plan offering these groups upfront money to invest and create these systems, and then sharing the cost savings with them on the back end. And for those that aren't a part of an ACO, because maybe they don't take a lot of Medicare, private insurance also is offering shared savings year over year. You can be eligible for bonuses in many of these private insurance companies based on how well you manage your patient base. So the government is really pushing for doctors to offer what's called patient-centered medical homes. And that's really to help them meet the responsibilities of patient engagement and ensure that we have a better chance of the patient acting on that information and actually having an effect on health care. So they're, like I said, sharing the savings in the health care costs, and they're increasing revenue through integrative wellness services. They're improving the patient experience or satisfaction referrals, and they're utilizing special billing incentives like the annual wellness visit or the intensive behavioral counseling therapy now for any patient that has a BMI of over 30. They don't need a comorbid disease anymore. The only requirement medically is a BMI of over 30. So the government is really pushing for doctors to start addressing weight loss, to start addressing prevention, and they're incentivizing them with additional billing. So, for example, the annual wellness visit is a $179 reimbursement, which is very high for a reimbursement, and then it sets the patient up with a health plan that incorporates further prevention screening throughout the year, which is additional visits to the doctor's office. So when it's all said and done, each patient each year for each doctor could be $300 to $500 at a minimum in revenue just for managing their prevention, and that's a government incentive. And the intensive behavioral counseling as well. They know if a patient will lose even just 4 pounds, it has a huge impact on the healthcare burdens of this country. So they really are incentivizing doctors, all doctors, but in particular these large, great, some of the incentives that they're offering. And then, of course, like I mentioned, the increased visits to manage prevention, testing, and interventions, because we do the test, and then we have to intervene, and then we have to retest to make sure that clinical protocol is having the desired result. All of that can lead to a more robust practice, and the government is happy to do that because they're achieving their goal of patient engagement and compliance and improved outcomes and reduced healthcare costs.
Well, I'm sure we're going to get more into this in the discussion period and the question and answers at the end, but I think it's worth noting that there's, I think, a broad perception, if it's safe to say, that everything is sort of moving in this direction anyway. So today, patient engagement may be a part of meaningful use, but down the road, it may be the whole ball game, really. I mean, really having sort of the pay for performance rather than pay for service, all of those changes seem wrapped up in this.
Oh, absolutely. It's no coincidence that, the EHR and meaningful use and the Obamacare and the Omnibus and the ICD-10 are all coming out at the same time, these incentives for annual wellness visits and intensive behavioral counseling, because really they'll work a practice right out of business if they're not following the game plan.
Right, and you just have to assume that the game plan is going to become more aggressive over time as well. Oh,
yeah, it's always a carrot and a stick.
Mm-hmm.
The carrot was meaningful use. The stick was do it or reducing your reimbursement 2%, 1%, 3%,
Right. Then the stick for meaningful use is coming pretty soon.
Exactly.
Okay, so let's talk about secure messaging then. Why? So that's one of the great features of patient engagement under Stage 2. Why are patients coming to expect this? Why do practices need to implement this stuff?
Well, I mean, it's just simply a digital world. I mean, it used to be a fast food world. Now it's a digital world. I mean, convenience has become, so second nature that if your phone goes down for even 2 hours, you really don't know what to do with yourself. And patients are so used to having information at their fingertips at any time flight information, Wikipedia information, WebMD information, drug information, that, why can't they get their personal health information? It's really a pain as a patient when you have to go see a specialist or you have to change to another physician in the old world or in the current state, getting those medical records, signing the release form. Some of them are x-rays, some of them are digital imaging, some of them are, it's almost impossible to really switch doctors and not have to start over from scratch. And that's what, of course, they're hoping to accomplish here. But from a patient compliance and a patient satisfaction standpoint, what's going to happen is when 50% of the market is offering this type of information and communication, the other 50% isn't, who's the patient going to choose? And the other thing is, eventually it will be second nature, and patients are demanding it. Multiple practitioners need it to be fiscally responsible with healthcare dollars and to ensure, of course, proper testing and no redundancy in testing and proper management of medication, so they're not prescribing something that will contraindicate or cause complications with another medication. So patients are not going to want to be in an archaic environment where it endangers their health. And I hate to say that in such a dramatic way, but death from improper medication, I think, ranks pretty close up there with cardiovascular disease. I mean, nobody talks about it, but medical mistakes are one of the biggest killers out there. So a patient is at some point going to say, I want to work with a physician that can get me my information when I want it, as I want it, just like everything else. So I think it's going to become huge in retaining your patient base and growing your patient base. It's going to be even easier for patients to switch doctors, and you're going to have to give them all the reasons why they should stay with you.
Yeah, I think this is a great point because I really do think that already we hear all the time from providers about patients asking them to email information to them. And, of course, there's a lot of concerns around that because most of the email that folks out there in the world use is not secure at all, and so it's not good from a HIPAA perspective. But we're already hearing that patients expect this technology, and I think it's just going to become, as you were saying, it's just going to be expected in the future. There's not going to be any excuse for not having it.
Yeah, it's kind of like when everybody started text messaging and somebody said, oh, I don't text message. I was one of those people, which is why I bring it up. I'm old-fashioned, I like to hear people's voices, but, within 3 months of making that statement, I think 50% of my communication became text messages. It just takes over so fast, and you either get on board or you miss the boat, and that's pretty much, I think, the way it's going to be with this digital exchange of health information.
So you talked a little bit before about a patient-centered medical home. What does that have to do with patient engagement and sort of what we're trying to achieve with health policy?
Well, the medical home model is a promise, or if you will, it holds promise as a way to improve health care by transforming the way a primary care office is organized and delivered. So it's that transition from sick care to well care, or to a higher level of preventive care. So it comes down the pike from the Agency of Healthcare Research and Quality, and they define it as a place, but really more of a model for the organization of a primary care to deliver core functions of primary health. And those core functions are comprehensive care, patient-centered care, coordinated care, accessibility of services, and quality and safety. And so really, just to give you a brief bullet on each of those, the comprehensive care is really dealing with patients' individual issues in all areas of their health. Primary is one of those areas where they really become the master of all until an issue becomes so complicated it has to be sent to a specialist. So they need to have advanced nurse practitioners, physician's assistants, pharmacists that they trust and work with, nutritionists, social workers, educated care coordinators. I mean, it really becomes quite a feat to provide comprehensive service, but it's what the government wants, it's what the patient needs, and it's part of what a physician needs to put on their goals for their practice. And that patient-centered is really about partnering with the patient and their family, understanding and respecting each patient's unique needs, culture, values, and preferences, and get them to actively participate, learn, manage, and organize their own care. And that's all of the things that we've really been talking about throughout the whole day. And then, of course, coordinating that care with their other healthcare providers and the health system at large. The accessible services is just what we were talking about with the communicating via electronic, or the way that the patient prefers to be communicated with. Ultimately, we all communicate a little bit differently nowadays. We have multiple choices for how we want to get our information, and so the government and the healthcare provider networks out there want us to make sure the patients are getting that information in a way that they'll actually read it and utilize it. And then quality and safety is really just about evidence-based medicine with the proper clinical decision and support tools to make an impact and steer the patients in the right areas and make sure that that engagement is there, that action is there, and that we're getting the desired results in a safe and effective environment and manner. And so, practices can apply once they've created this system in their office and they're, working on all 5 cylinders, if you will. They can apply, and in the future, it's going to improve their reimbursements from billing if they are complying with this patient-centered medical home or becoming a certified patient-centered medical home. And I brought it into the presentation because I think it's important. I mean, it's a buzzword out there. I think doctors are trying to figure out how to do that or what it will really take to do that. And basically, it will take complying with everything else that you've been hearing for the last 4 years, and doing so in a manner that's successful inside your practice.
And so if this question isn't painfully obvious, this is a system or a program that's administered by CMS?
It came down the pike from the Agency for Healthcare Research and Quality, and
Okay.
they work closely with CMS. So it was designed to meet the requirements of Obamacare. It was designed to help quantify and help physicians, if you will, especially primary care physicians, understand, what it is that should be going on in order to enact the change that they want.
Okay. So here's a question that's probably keeping some folks up at night as we approach stage 2. And so what can these practices do to make a smooth transition to patient engagement in stage 2?
Well, understanding the medical landscape is definitely, priority number 1. I think that they know that the problems that they have inside their own existing practice, and we can focus on those or we can focus on the solutions. And, the idea that they're going to be able to take their time to spend 20 minutes with each patient educating them when their time is worth, $300 an hour doesn't make financial business sense. So I think that hiring a dedicated wellness administrator inside of their practice, somebody to coordinate that patient engagement, to educate on the doctor's treatments and recommendations, and follow up and ensure that we're getting the desired results, send out the reminders, utilize that person fully to meet your measures for stage 2 environment, meaningful use, as well as to get the desired medical outcome. I mean, there's a way to utilize that dedicated person to help you navigate this landscape in a manner that costs much less than their $300 an hour. On average, I think somebody in that type of position is making $17 to $20 an hour in a practice. So it's much more cost effective. Also, possibly adding a licensed clinical nutritionist, which is a billable health practitioner for weight loss and for nutritional counseling, because medical nutrition is most often the first recommended medical protocol for a lot of these age-related diseases. So there's ways to utilize just a couple of additional support staff to increase practice revenue and comply with everything that's coming down the pike to build a robust and profitable practice. They can partner with experienced vendors to integrate wellness revenue streams get a practice analysis to identify what areas of their practice they have opportunity for better patient outcomes and more practice incomes, and really get advanced training on meaningful use compliance, get advanced training on integrating some functional medicine and wellness and medical nutrition, and understand and create an environment in your office that invites patient education, invites participation, and embraces automation, so that the patients get the best experience and actually act on what they learn. And a huge part of that, too, is getting your whole staff on board with the direction of where you're going. I can't tell you how many times a doctor has been ready to move forward and their staff just argues, bucks the system, doesn't want to change, doesn't want to add tasks. So I think that, really letting them know, hey, healthcare is changing. If you want to have a job, you're going to need to understand the direction of this office and where we're going, and positively promote what is happening here so that we can thrive and you can remain employed. And I hate to make it so cut and dry, but it really is the case. They need a unified goal and a plan to get there, and then they need to plug away and do their didactic learning and do their application and get comfortable with it, and before you know it, it'll be second nature. One way to ensure that is to find partners that offer adequate training and support for your transitional phase, just like doctors experienced with EMR when they first rolled it out. They thought, no problem, had a software, changed the whole way my practice flows. We won't need that much training. Training avoids problems. Training makes things more cost effective. You don't have to make the mistakes, all on your own. Many offices already made them. A lot of companies can help you avoid those pitfalls, learn the right way to do it the first time, and improve your ROI and chances for success. And really incorporating a wellness revenue center to offset the cost of improved patient education and follow-up. The nice thing about what's going on is there are plenty of revenue centers that can be added to a practice. And if you approach it right and you integrate them, you're going to meet the requirements, you're going to improve patient outcomes and practice incomes, and rather than it feel like you're walking to your doom every day because your billing and reimbursement and personal time obligation is increasing while everything else decreases, you're scheduling yourself or setting yourself up to thrive and profit. And I think that's the direction that any physician's office would want to go in. They can see the writing on the wall, and it's in plain black and white, bold letters. So might as well embrace it and enjoy the change.
Absolutely, because this stuff clearly isn't going to go away. And so in many respects, this is a bridge to sort of where medicine's going to be in coming years. And it just makes sense for a practice to embrace it and learn how to make it work today rather than wait and have to catch up later.
That's right. That's right. Lead the field. That's really what our goal is at our company, is to lead the healthcare evolution. And healthcare is evolving, and you can't stop it, so might as well understand it and participate.
And thrive, hopefully.
That's right.
All right, well, we have plenty of time left for questions and answers from our guests. We already have some questions, but I would encourage anyone else on the line to go ahead and type those questions into your chat area, and we'll share them with our presenter. This is a rare opportunity to ask your questions about Stage 2 of meaningful use and patient engagement. So let's go ahead and ask the first question that's come in. This question is about the patient summary, which I know you didn't address in the presentation, but the question is, how should behavioral health patients be handled when it comes to the patient summary?
Well, I think this is where, the family and the support mechanism and engaging the families, and I'm guessing from behavioral health they're talking about issues where a patient's mental capacity to keep their information secure or private, or who knows if they'll eat it, burn it, or hand it to, somebody down the street. If we can clarify that, I think that's their concern. I think that would be where, obviously understanding who is caring for that patient. If there is no one maybe the electronic version of the patient summary would be a wise way to go rather than printing it out and handing it to somebody that's maybe got behavioral or mental issues that would preclude them from responsibly handling that information, or even in those cases coordinating it directly with other care providers if there is no family or support mechanism. I mean, obviously you have to use your clinical judgment. They'll know their patient, but yeah, I think that would just have to be a judgment call, and or in dealing with those types of patients, you would reserve the electronic communication via patient portal or email or secured email, or directly to other care providers.
Well, that dovetails nicely with another question we had from an audience member, and the question is, are there special rules about how families can access patient engagement tools?
I think that, I'm going to say that I don't know for sure the details on all of that, but I will say that my understanding of it is, the patient information is given to the patient, and if they want to share that login information with somebody that's coordinating their care, and they have shared that information with that person themselves, I think that alleviates any concern, and that's how that would be handled. In the instance that we just discussed, where maybe it's a behavioral issue, I know they have consent forms that they have signed for anybody managing their care, in which they can, just like they do for a medical release form for sharing with another physician, where the patient signs off and says, you can share my information with so and such. And then the doctor is covered from the standpoint of being able to give that health information to that care coordinator, if you will, in the family. So just the normal standard medical release forms is my understanding, and or if you are able to share that information with the patient in a manner that doesn't give it to them physically, where they can access it online and they have the capacity to share that login information with their care provider and they choose to do so, then that's another way to get that information over to the proper care coordinator.
I'm going to skip ahead and come back to a question. I want to ask this one, though, because I think it's an interesting issue. The question is, do you feel specialists will receive less referrals as a result of the changing wellness landscape? I worry that our revenues will suffer.
I think the answer to that is yes and no, and I'll explain. I mean, doctors are going to be offering, primary care doctors will be offering and integrating more services, and possibly, bringing back in-house some of the testing and some of the services they may now be referring to specialists. But with that being said, there's a lot of doctors that are not doing that. And if a specialist takes in these same wellness programs and protocols and standards of care, they can certainly make themselves a leader in their field and work with the doctors that aren't providing those services, that will be happy to hear that the person that their patient that they're referring is going to get that level of care at that specialist and have a better outcome, because they both end up being responsible for the healthcare burden costs of that patient. So I think that, yes, it will have an effect, but there can be a counter or a plan to minimize that effect if a specialist incorporates wellness into their practice. Our company started with primary care because we know that it's the primary place to work on prevention, but we will have specialty wellness programs for different specialists as we're moving forward. So it's not because we didn't feel it was something applicable, it's just we wanted to start at the beginning. But it certainly will fit into many specialist office, because every area of health can have its own custom tailored wellness program to target the improvement of that health condition. So they're equally able to incorporate these types of patient engagement and wellness protocols in their practice, and should.
Yeah, it's an interesting issue because obviously you want appropriate use of specialists, I think, is one of the important goals here. But that doesn't mean that sort of work is going to go away. But you can see why there might be some anxiety around the transition and how this is actually going to play out.
Oh, absolutely. And I think cardiology and primary care are a perfect example. There are a lot of things that the primary care is currently referring over to the cardiologist and can be doing themselves and are starting to do themselves, and that does affect. But at some point, the level of care required is still going to need a specialist. They're still going to need a cardiologist. They're still going to need a cardiac catheterization or a calcium score, or some of the more robust testing that primary care would never bring into their office. And so I'm seeing exactly what I just said. There are cardiology offices that are calling themselves prevention cardiologists, and they are incorporating these services and making themselves a leader in their area, and all the doctors that currently aren't integrating wellness are like, wow, this is the best cardiologist, send my patients over there. So it certainly can work both ways.
So here's a sort of a follow-up question. And the question is, are specialists required to comply with meaningful use? So one of the issues here is that no one exactly is required to comply with meaningful use. It's an incentive program, and then becomes kind of a reimbursement adjustment. There is that stick coming down the road, but maybe you could address that issue.
Right. Yeah, I mean, like we mentioned earlier, carrot and the stick. The government wants to see doctors and primary specialists, hospitals, home health care, physical therapy. I mean, they want to see care coordinators coordinating. They want to see everybody exchanging these records freely. They want to be able to ensure no redundancy in testing. So, yes, I mean, meaningful use applies to specialists as well. If they chose to get an EHR and have the government pay for it so that they could be in compliance and not have their billing affected negatively as the date grows closer to when physicians are required for utilizing EHR. And again, it's not required, but if you don't, we're going to pay better the people that are communicating with us the way we want to communicate and the way we want them to communicate with each other. And so they're calling it an incentive, but they actually are taking away a couple percentage points. So depending on your goal as a physician, depending on the amount of patient engagement and there's a lot that an EMR does that we're not talking about from a standpoint of graphs and charts and managing coding and helping to remind for preventative testing, and that can really help a practice and improve, the management, the running, the billing, and the patient outcomes just by properly managing prescriptions. And I mean, there is intrinsic value in an EHR. So for meaningful use, it's just a matter of whether or not you want to be reimbursed for the investment in that EHR if you are going in that direction. So the answer is yes, although it depends on whether or not you're participating or choosing to participate.
Well, here's kind of a tricky question, although I'm glad somebody asked it. And the question is, what's the difference between a patient-centered medical home and an ACO?
Well, they can be congruent. They can be the same. So an ACO is a group that come together to practice medicine in a similar manner, to basically in a way have group purchasing power, who wants to practice better medicine, follow the Obamacare guidelines, and participate in a percentage of savings. They're looking at changing the way that providers get paid, from, like you said, pay for service to pay for performance, if you will, in the cost savings. So they incentivize doctors to be part of the initial launch of the pilot of ACOs, and now they're past that initial phase, and they're just encouraging, hey, if you want to make more money from Medicare, this is what you need to do. Join a group and manage your patient base better. A patient-centered medical home is going to be, the group could all be patient-centered medical home practices. But an individual practice or an MSO group or an IPA group or hospital group or just a multi-specialty group, they can apply and provide this level, so the same focus of an ACO they can incorporate into their own private practice and then apply and be certified as a patient-centered medical home, which just gives them recognition with a CMS and private insurers that, hey, I'm here too, working toward the same goal that an ACO is working for, if you will. And so it's just really a guideline and a roadmap to what it is that they're looking to achieve and how they're measuring that success.
But it sounds like it's definitely safe to call them complementary approaches.
Yeah, they're the same. And then, like I said, an ACO can have 100 doctors, and they can all be doing the 5 measures of patient-centered medical home, and they apply for certification, and that ACO is a patient-centered medical home ACO. So they can be the same, although they're not. But it's basically the same goal. It's
right.
just another way to say it, and be recognized for what you're doing.
Interesting. So here's a question we get a lot around patient engagement, and the question is, how can we get patients to actually use the patient engagement tools? And I think the reason why we hear that question fairly often is I think there's some nervousness among providers that they'll actually be able to find enough patients interested in the tools to get that 5% threshold they're supposed to hit. What would you say to that question?
I would say I'd be scared too. I mean, I was thinking about just that before we started the call, and one of the things with this dedicated wellness administrator is there's so many different things that the wellness administrator can do, and one of the things that we teach doctors to use them for is follow up with the patient after the doctor has made their recommendation and treatment plan, and maybe they co-prescribe some nutraceutical as mono or adjunct therapy or a lifestyle modification, and or just want to schedule them for some prevention, make sure they understand their disease state a little better. I would train that wellness administrator, and I advise doctors train them when the patient walks into their office. Have a screen and a login, connected to the internet facing the patient, so they can go right online into their patient record and view it and even share it with another physician, so that that wellness administrator can help meet that requirement just in daily visits. And or as they follow up, if the information isn't immediately available and they need to share it a day later, that person can send the patient an email, schedule a call to help them log into that patient information for the first time, and download and understand their results or medical record. So you're right, and they're right. Without having someone, especially in an area where you have a very high Medicare, Medicaid, elderly population, getting them to email and Google is about all you're going to get them to do. And so how are you going to meet that requirement? And I would say with staff support and a little bit of patient education, and that's what they're hoping for.
Well, I think that's a standpoint. I think that's a great point, because so it's not enough to just wait for the patients to show up and use the tools. You really need to engage with them on a personal level to get them sort of priming the pump, so to speak, so that they'll actually be aware of the tools and realize how easy it is to use them.
Yeah, I would actually, encourage it to be that follow-up visit. So the patient comes in, they have their annual wellness visit, they get their health plan, the doctor's ordered some tests, the test results come back, the patient comes in to meet with the doctor. I'd pull the results right up from their portal. That way the patient's logging in, engaging, seeing their results, and, you can show them how to access it, enter it, and it's not an unknown, and they're not like, I don't want to go in there. Who knows if I'll be able to log in? What will I see when I get there? Will I even understand it? Just a quick 2-3 minute, here's your results. This is what we're going over anyway. So let's just log into your portal so you can see how to access this information after you leave, would be the way I would do it.
Yeah, I think that's a great idea and a great suggestion for folks out there. Well, I'm afraid we're nearly out of time. I want to remind our guests that we are going to assemble the questions, and we'll post written answers on our site with links delivered by email later in the week. So if we didn't get to your question, don't worry, we'll get to it in the written responses. I want to thank you, Heather, for joining us for today's Learning Lunch.
Thank you, Brian. It was a pleasure to be here.
Well, it was a very informative session, and I want to let folks know that if they want to learn more about Heather and iMedical Consulting and the training that they offer, they can visit www.i-medicaltraining.com. Maybe you could take just a minute to tell us about the services that you provide.
Yes, we have an online interactive training platform that teaches doctors how to integrate wellness services and additional advanced testing and revenue centers into their practice, and help to apply and become a patient-centered medical home, as well as support, of course, their compliance and their meaningful use and their ICD-10 and other compliance and practice management needs in a manner that's on demand and also trains their whole staff. One of the biggest issues that we faced as consultants was getting face time with the doctor, getting time to train them adequately on medical protocols, on administrative and marketing, things that they just really didn't have time or energy to focus on, and getting the staff engaged. So really everything that a physician needs to learn and understand from a medical side, and everything that their staff needs to learn and understand and apply from an administrative and marketing side and patient engagement side, is all online and available on demand. And it's testing and tracking, and the doctor can really manage the education and growth of their practice through the online tools in the comfort of their own home or office or wherever they choose to get that training. And we also support them with free telephone consulting through the 12 months of their access to the training materials, so that as they're going along and experiencing different things medically and administratively, they have a partner that they can call and ask, what should we do here? And really get that support and leadership and direction that they need to navigate the pitfalls and avoid some of the things that might slow their progress or their profitability.
So for folks looking for more resources around these issues, you should definitely check out www.i-medicaltraining.com. Thank you again, Heather, for this session.
Oh, thank you, Brian. And our gift to all the participants is there is a link on the homepage of the website for a free practice analysis. It takes about 5 minutes just to kind of get a snapshot and picture of what their patient base is like, what their what clinical diseases or issues that they're dealing with, and it customizes a proposal of what different types of things they can do for their practice and what that would mean for them financially. And that's a $750 value, so feel free to go on and take the free practice analysis.
Yep, that sounds like it'd be a great opportunity for folks out there. Do visit imedicaltraining.com and take advantage of that opportunity. I'd also like to thank all of our attendees. Remember that all registered attendees of this event will receive an email with links to both recorded and slideshow versions of this session. For comprehensive training and meaningful use, which we've been talking about today, register for Format Approved's Certified Meaningful Use, or CMUP, professional course. The course covers the requirements for both Stage 1 and Stage 2 of meaningful use for both eligible professionals and eligible hospitals, along with clinical quality measures, HIPAA considerations, and more. Visit formatapproved.com/education/courses_CMUP.html to register or learn more about this course, and you can see the URL on your screen there if that mouthful was too much. Visit formatapproved.com to learn more about our upcoming learning lunches. The Learning Lunch button will take you to our entire slate of upcoming webinars. Our next Learning Lunch will air on September 25th, that's tomorrow, and we'll cover the subject of health information exchange and interoperability. Are you connected in your community? Keep an eye on your email box on our homepage for other upcoming topics, and thank you again for joining us today.